Deep down, the narcissist hates himself, but he will never acknowledge it. Instead, he will project that hatred onto others. If you want to identify if someone is narcissistic, the best way to do so is to disagree with them or criticize them and see if they react the way I was describing. The truth is that narcissists have a very fragile self-image, and in order to feel good about themselves, narcissists need a constant stream of attention and admiration from the people around them. This is called narcissistic supply. So narcissists more than likely also suffered some form of narcissistic abuse themselves as children. Healthy people after abuse from narcissists will themselves become narcissists, although their narcissism is more of the vulnerable type. Hi. This video will focus mainly on pathological narcissism as a condition and the personality type that is most affected by this condition, which goes by the name Narcissistic Personality Disorder, NPD for short. NPD is the personality aspect of the pure narcissistic character that we will simply call the narcissist moving forward. There are many different character types, but they are not to be confused with personality types. Personality and character are two different things. For example, the psychopath is a character type. The personality aspect of the psychopath would be a combination of many personality types, with the predominant one being antisocial personality. The narcissist, the sociopath, and the psychopath are all different character types and should not be confused with each other. If you want to know the difference between psychopath and sociopath, watch my video about sociopathy. I'm not going to go too much into details about character types in this video. Just know that there are 5 main categories of character types, with many subtypes and hybrid types. I will do the video series on characters next once I finish the personality type series. So, back to narcissism. This is a condition that can touch every character type and will manifest itself differently depending on the character. For example, narcissism on a psychopathic character will be different from the narcissism touching a schizoid character. The narcissist is the character type whose personality is completely shaped by the narcissistic condition and NPD. So, let's look at some characteristics of NPD. Grandiose sense of self-importance. The narcissists want to be recognized by others as superior without any basis for it. They want to be recognized as the best at doing something just because they think they're the best at it. Their performance can be good sometimes, but it can also be just average or below it. They think they're so special and so complex that normal people just cannot understand them. They can be perceived as arrogant and with an excessive sense of entitlement. Narcissistic personalities crave admiration from others. In conversation, they will talk about themselves and will always be fishing for compliments. They also lack empathy for others. They are unable to understand the feelings, thoughts, and perspectives of others. They just can't connect with other people because they are too focused on themselves. They have an excessive preoccupation with fame, status, and success, and they can be extremely competitive. With narcissists, everything can turn into a pissing contest. They are also plagued with constant envy and jealousy of others. They are what we would call haters. In their personal relationships, narcissists only hang around people that they can benefit from and exploit. They will always try to exploit people's kindness without offering anything in return. They take and take, but offer little in return. Narcissistic personalities focus on their external appearance and how others are perceiving them. Narcissists can be described as control freaks. They're obsessed with controlling their image and controlling how they are perceived by other people, to the point that they are willing to lie and to abuse other people in order to maintain control over that image. The truth is that narcissists have a very fragile self-image, and in order to feel good about themselves, narcissists need a constant stream of attention and admiration from the people around them. This is called narcissistic supply. Narcissists will surround themselves with empathic and codependent personalities because they are easier to control and willing to give narcissists the attention and validation that they need. Narcissists don't like the truth when it doesn't match their self-image and challenges their delusions of grandeur and false narratives. If someone disagrees with them or criticizes them, inside they will feel humiliated and they will take it personally, even if the criticism was constructive or delivered in a respectful and polite manner. The narcissist will instead respond with sudden outbursts of anger and childlike temper tantrums. This is the famous narcissistic rage. It's reactive and explosive, and in this state, the narcissist becomes abusive and vengeful. Once the outburst is over, the narcissist will hold a grudge against the person and they will actively seek revenge against them. This is where the narcissistic abuse begins. If you want to identify if someone is narcissistic, the best way to do so is to disagree with them or criticize them and see if they react the way I was describing. However, the narcissist can also respond to the criticism by faking humility and humbleness if the disapproval comes from a boss or someone they regard as an authority figure. If no immediate outburst happens, narcissists will search for and create conflicts as a way to alleviate the built-up negative energy within them, and releasing it on an unsuspecting victim like a subordinate, a spouse, child, pet, or, as a last resort, trolling on the internet. As for what causes narcissism, physiologically, brain scans of narcissists have shown an abnormality in the level of gray matter in the brain, especially in areas associated with empathy and compassion. Whether this brain damage is genetic or caused by early trauma to the brain is still unclear. More likely, the causes for narcissistic personalities to develop are environmental. The child receiving excess praise and then excessive criticism, low empathy from parents to the child, with one or both parents being also narcissistic. So narcissists more than likely also suffered some form of narcissistic abuse themselves as children, the result being a child with a fragile self-esteem and lots of internalized toxic shame. We all have and need a level of healthy narcissism in our ego structure. It's what allows us to have self-esteem and confidence in ourselves, have boundaries, and be assertive when challenged. A central concept to understand is the early narcissistic injury. It happens when the child suffers some form of rejection, when his needs are not met, when his boundaries are not respected, when the child is humiliated and abused. Of course, narcissistic injuries from our caretakers, authority figures, and environment are unavoidable. That is a truth of life that one must come to terms with. And humans are psychologically well equipped to handle it with this process. After a narcissistic injury, the ego inflates as a protective measure and healing mechanism. Once the healing from the injury is complete, the ego can then be deflated, and the result will be a healthy psychological growth and the maturity of the personality. However, the problem arises when the narcissistic injuries are consecutive and in high volume. In other words, narcissistic abuse. When a child is subjected to narcissistic abuse, his boundaries are constantly transgressed and run over. The ego is not getting enough time to process and heal every injury. What happens then is that the ego hyperinflates and the narcissistic behavior loses its temporary defensive healing role and instead becomes permanent and pathological. The personality is not given enough time to process all its narcissistic wounds, heal them, and mature. As a result, psychic growth of the person is halted and the focus shifts to only strengthening the superficial ego. The narcissist becomes then an individual with an overdeveloped ego on the surface, protecting a wounded, fragile, infantile personality underneath it. Narcissism is toxic and contagious. Anyone can become narcissistic from exposure to narcissistic abuse depending on the degree of severity. Exposure to narcissistic people can cause an otherwise healthy adult to mimic the narcissistic behavior. At first, it is only superficial. But if that behavior is internalized, then narcissism can slowly start to take hold of the personality structure. Healthy people after abuse from narcissists will themselves become narcissists, although their narcissism is more of the vulnerable type. So many narcissistic abuse victims themselves become narcissists afterwards, because what they consider healing from narcissistic abuse is in fact just transforming their post-abuse vulnerable narcissism into a grandiose one. This is why it is critical to identify the narcissists in our lives and get rid of them before they can cause any damage to our good nature, because that damage can be irreversible. All narcissists are caught up in an inner turmoil because of a mismatch between their idealized image and their real self. This internal conflict pushes narcissists to try and project their idealized image and impose that perception on the people around them. This attempt at controlling people's perceptions is what leads them to lie, cheat, manipulate, and abuse the people around them. As for the suffering that they cause to the people around them from their behavior, narcissists just see it simply as collateral damage, because for them the priority is to maintain their perfect image at any cost. Deep down, the narcissist hates himself, but he will never acknowledge it. Instead, he will project that hatred onto others. The narcissist wants to corrupt the values and morals of normal, healthy people. It gives them great satisfaction and pleasure, turning a healthy, joyful individual into a sad, miserable, insecure, and dysfunctional victim. The narcissist deep down hates himself, and every time they see a normal, happy person, it reminds him of his sad internal reality. And going back to the narcissist's delusional belief in her superiority, they will not tolerate having someone else being happier than they are. They will drag everybody down with them because if they are not happy, no one else deserves happiness. This is why narcissism is the most toxic and malignant of all the personality disorders. I want to finish this section by pointing out that almost all females are at risk of being subject to narcissistic abuse in one form or another at some point in their lives. That is because in most cultures, females are not encouraged to be assertive and have healthy boundaries. And since narcissism is toxic and contagious, all females are prone to becoming narcissistic. And it doesn't help also that the culture places a high importance on appearance and image, especially for females. So it is safe to assume that narcissism is very prevalent in female populations, although feminine narcissism will be more of the covert vulnerable type than the grandiose type. This leads us right into the next section about subtypes of narcissism. Depending on the character type, the expression of narcissism can come in two forms: vulnerable narcissism or grandiose narcissism. Keep in mind that the narcissistic condition can fluctuate between these two states. Every narcissist can be grandiose and vulnerable, with one state being more dominant than the other. An individual with grandiose narcissism is overtly arrogant, bold, doesn't get discouraged by criticism, and is aggressive. Grandiose narcissists are extroverted, optimistic about future outcomes, and they have great superficial charm. This is the megalomania aspect of narcissism, and it's also the one that comes to mind the most when people hear narcissism. On the other hand, we have vulnerable narcissism. This is the famous covert narcissist. In vulnerable narcissism, there's insecurity, resentment, and mistrust of others. A vulnerable narcissist is hypersensitive introverted, overly defensive, has high levels of anxiety and depression. The vulnerable narcissist can also be pessimistic, neurotic, socially awkward, and shy. People with PPD, for example, have vulnerable narcissism, also avoidant personalities, schizoids, and paranoid personalities, just to name a few. Vulnerable narcissism has a better potential for healing than the grandiose type. The main problem for people with vulnerable narcissism is shame, so working on their toxic shame will help them improve and change for the better. Comorbidities of narcissism include depression and anxiety, bipolar and manic disorders, anorexia and eating disorders, and substance abuse, especially cocaine, just to name a few. Narcissism is by far the most toxic of personality disorders and the most difficult to treat. Narcissists rarely seek therapy because even if their behavior is unhealthy and dysfunctional, this same behavior allows narcissists to find success and thrive in our materialistic culture. Therapy is considered ineffective in treating narcissism and NPD. Not only is it ineffective, but it is believed that it makes the condition even worse because it gives the narcissist new knowledge that they can use to exploit others. Therapy also gives narcissists a form of narcissistic supply, an attentive audience that is willing to listen to them in the counselor. Thus, it also reinforces narcissistic behavior. So, for therapy with narcissist, the counselor must be willing to not only listen and validate the narcissist, but to also challenge the narcissist's delusion, fantasies, and distorted sense of reality. But this can be a challenging task because, as we said previously, it risks invoking narcissistic rage as a defense mechanism, and if it continues, the narcissist will opt to terminate his therapy. If, on the other hand, the narcissist keeps going into therapy and keeps working on improving him or herself by abandoning the toxic attitudes and behaviors, and by working on developing empathy and understanding for others, what will happen is that once the narcissistic behaviors are completely abandoned, then all that person will be left with will be a wounded, fragile, underdeveloped personality. This uncovered post-narcissism personality is something very similar to an avoidant personality. This is the authentic self that the narcissist had abandoned in early life. The narcissistic behaviors were defense mechanisms that the narcissist adopted to protect his fragile self. Only once this underdeveloped authentic self is exposed and is given enough time, attention, and care to heal its old wounds and grow on a stronger, healthier foundation, only then can there be true healing for the narcissist. But this takes a tremendous amount of effort, time, and courage, and more likely than not, narcissists will not get this far except in a very few rare cases. In the next video, I will focus on avoidance personality and how it relates to narcissism. I want to finish by saying this. In today's world, there is a narcissism epidemic, and it touches every one of us to some degree. It's only through awareness and understanding of narcissism that we can overcome this malignant condition. This was only the first part in a series about narcissism, because this is a very deep topic and we only scratched the surface today. If you got something you want to add to the discussion, please do so in the comment section. I respond to almost all the comments. Also, please share this video if you think it can help someone, and subscribe so you don't miss out on future content. Thank you.